recruiting never stops. Even during a pandemic, it does not stop. You've got to keep trying and trying new strategies and new ways to try and recruit folks.
One thing also that we did very proactively, I thought, was, when people leave the company, we've already invested in training them, in hiring them, and getting them fit into our culture, making sure it works, having that relationship, that engagement with them. So I pulled a report for the past 2 years for employees who left the company, and we managers looked at the employees to say, who would we be comfortable calling back in? And we went through that vetting process, and we actually ended up rehiring 4 employees in the healthcare position. So that helped, because the onboarding, the training was a lot faster for them as opposed to someone who's just not familiar with John Knox.
We've done a lot of emphasis on Facebook postings, and not only just jobs, but also just kind of back to Wendy's point, just people seeing what we're doing at these facilities, and just the activities and the fun things we're doing, even during the COVID crisis with the elders, and what a great place it is to work. And I think that just the added putting out pictures out there has also brought us some good recruits, because people see it and say, hey, that looks like a great place to work, and I'd really like to be a part of that. If you work in the recruitment arena, recruitment's never over, and even during a crisis like this, you have to continuously think of ways to recruit people, and that's what we've been able to do, and really fill some positions that we hadn't had filled in a while.
I think you might be referring to who's involved in the interview process. So everything's virtual. We're doing it through Zoom, Facebook, WhatsApp. But we are very fortunate at John Knox, because we have sages who who volunteer to be in our greenhouse homes, and they are part of the interview process as well. It's so important, because they have a deep knowing of the employees, the Shabazim in the homes. They have a deep knowing of the elders, and a very deep knowing of the process in the short-term rehab homes as well. So they are now part of the screening interview process. We have an onboarding program where the manager will reach out to the new hire before their start date, just to say welcome, work out the kinks of schedules and everything like that. But you have to start it off on the right foot. And you do that with communication and relationships. For the first couple of weeks, we didn't. People would come in and we would just give them the forms. However, we literally continued to roll out the red carpet. I mean, we actually have a red carpet, and we just roll it out. On their first day coming to John Knox, we want them to feel like stars, because we want them to treat our customers, who are one another, as well as the elders and residents here, like stars.
We've also assigned them at each of the greenhouses, these students, we've assigned them kind of an informal mentor to welcome them to the facility, to make sure they understand, particularly all the ins and outs with the COVID. Wear your mask, here's how you do it, here's what we do. And that's worked well, because we've got not only some really excited long-term employees that are excited about mentoring someone, but also it builds that relationships with the new employees as well.
When you're talking about staff, to really just treat them with respect, communicate with them often, honestly, recognize them for their efforts, and that hasn't changed, current. So that continues. That retention is important. Let's face it, people leave their companies, their jobs, because of us, of management. So whatever we can do to do better at that, I think is really important.
When all this first started with the COVID, we initially implemented a emergency policy. And one of the components of that was that if you became ill, with COVID, or one of your family members became ill with COVID, and you had to quarantine at home, that we were going to continue to pay you your full pay, and you weren't going to use PTO, EIB, which is our illness benefit as well. So we sent that out, and that really, I think, made people feel better, because they knew that if something happened and they did get COVID, or their husband or whomever got COVID and they had to stay home, that they were going to be taken care of. The other thing was, we did offer some emergency pay to the essential workers, the CNAs, the nurses, those type of folks. And that was obviously a tremendous incentive to get people to work and continue to work those extra shifts that we needed them to work. And so that has worked out very, very well.
One of the other things that we did was childcare. Schools closed. We had people that had children that weren't in school anymore. So we worked all over the state to find alternatives where they could take their children and help them afford that. I think that's part of that strong foundation, is that from the beginning, our organization has tried to be very responsive to the needs of the employees in terms of salaries and benefits. So, like in the greenhouse and our long-term care homes, we try to pay better than the competition. We believe, really good benefits like health insurance that's fully paid for the employee, with a $750 deductible, and they can add their family or dependents on for like $125 a pay period. So that's like roughly $250 a month to insure your whole family. Life insurance, and then just general extended illness benefits, and also you start from that foundation and then added those other things on it. I think we just want to make sure that all of our employees were taken care of.